a little bit about that additional column?
Yeah, Jacob, thank you. I was trying to figure out where was a good place. We forgot to put it in the agenda
I know, I saw that too.
itself somewhere, talking about the agenda, around the agenda. Um, so Donda sent out an updated version providing the definitions, but you probably noticed on the right hand of the agenda, we have a new column, and it's a way for us to set expectations for the committee in terms of what roles per each agenda item we will be working on. And if you scroll down to Donda's updated agenda at the bottom of the page, I've asked her to provide some spectrum definitions. This is it's called a public participation model, and it's a way for basically, it's very intuitive. It's how the public participates in different externally facing meetings or even internally facing meetings. This works for internal groups as well. But if you scroll down to the bottom of the agenda, it provides some basic definitions, and then page 2 really goes into expands a little bit more on the definitions and so forth. But ideally, where we would eventually want to get to with any type of meeting, whether it be ours or any other meeting that folks are a part of, is it really helps get us to the collaborate and empower stage. That's ideally where every meeting would like to be, where especially this particular group, after reading the bylaws again and again, you'll see why it's important that we are all going to be in the collaborative empowerment stage of the spectrum. So if you scroll up just a little bit, Donda, for the definitions, thank you. So we have from the left to the right, we have informing to empowering. And the first piece is informing. And so you'll see that on the agenda, just providing information so individuals are understanding the different options, solutions, and so forth. The consulting stage is with members in this committee to obtain feedback, alternatives, and decisions. Involving members is really ensure that their concerns are considered throughout the entire process. And again, when I say process, we will look at the bylaws later this morning. And then, we eventually, as I mentioned earlier, want to get in this mindset that we want to collaborate with individuals, and then obviously empower individuals to make final decisions. And I think this is a key part of the actual role we have at Bhpac. So that being said, when we send out the agenda ahead of time, you'll see the columns on the right hand, and that way you know what's going on in terms of expectations for committee members and how we're going to really address a particular agenda item. So I hope that makes sense. We'll get going eventually, but this will be a new part of the agenda. I hope some of you may have ran across this in different meetings, but it's something that I've learned to be a part of in my time running or facilitating previous meetings, externally facing meetings in that sense. Are there any questions, thoughts, concerns?
No, thank you, Renee, for all your hard work on this. I think it kind of goes to the direction this committee is leaning, is making sure every voice is heard, that we are empowering our group members to have a voice in this process and this council. So thank you again for all your work on that. Donda, let's start off with introductions today. I hope everyone's staying warm. And then I thought, as a fun exercise, kind of an icebreaker while you're doing your introduction, just someplace you'd like to vacation to.
Oh. All right, let's go ahead. And Jacob, since you did that, let's go ahead and start with where do you?
Right. So my name's Jacob Marion. I am a person with lived experience and in long-term recovery from the disease of addiction. I am the co-chair of this council. I am also part of Step Denver's outreach process and the certification manager for Colorado Providers Association. And I hate saying this, I want to be someplace warm, but if I could go any place, it would be Ireland.
Oh, beautiful. All right. And how about Lori, since we got you on board today? Hope you're on mute, Lori.
Yeah, I'm sorry, I'm having to click both of them. So I am Lori Banks, and I am the Chief Administrative Officer at Aurora Mental Health Center. New to the council, so ready to get more involved. And believe it or not, if I had wanted to vacation somewhere, it would be Alaska.
Ooh, you guys are really into the cold. Let's go ahead and go with Ty.
Good morning, everyone. My name is Ty Smith. I am I'm chair of Colorado Silk Statewide Independent Living Council and your representative to the MHDCJS task force. And if I had to vacation somewhere, I'm also a peer, a person with lived experience. I actually really like Colorado, and nothing beats camping in our mountains. So I don't know if I'd want to do it right now, but other times maybe yes. Thank you.
All right, let's go ahead and go with Lloyd.
My name's Lloyd Moore. I'm a person in long-term recovery. I am on the recovery committee, the steering committee, and part of Last House on the Block. Probably my favorite spot to go to is Puerto Vallarta. It's a place I've gone to many times over the years. I'm also your membership co-chair.
Okay, let's go with Lori Gilroy.
Hi, I'm Lori Gilroy, a person with dual diagnosis, representing the Colorado Clubhouse Coalition, Colorado and Wyoming Clubhouse Coalition. And Lori, it was funny because I thought, well, I'd want to go someplace warm. And then I thought, but I really want to go to Alaska. So maybe we can go together on a cruise.
Sounds good. Count me in.
Okay, it's a party.
Let's stay with the L's and go with Lorraine Hull.
Oh, hi, everybody. I'm Lorraine Hull, and I'm a person with lived experience. And but it always shocks me when I could say long-term recovery, because I never thought I would get to that place. But I guess I am. And I'm also on the board for Life Ring Secular Recovery. And I would love to go to Hawaii. Been there a few times. I like the beach.
I agree with you. Okay, Jacob Fry.
Hey, good morning, everybody. Jacob Fry, Director of Operations with Sobriety House, Inc., a person with lived experience. My all-time bucket list vacation is and always will be Iceland.
Ooh. Beautiful. All right, how about Aaliyah Andrews?
Hi everybody, Aaliyah Andrews, Office of Behavioral Health. I am your recovery TA, and I would like to go to Florence, Italy. I could just sit on the ground. I could literally just sit on the ground for 2 weeks at that place. It's just magical. So
awesome. Megan Gallegos.
Good morning. I'm Megan Gallegos. I am the SRC Program Manager for DVR. I'm here just observing and shadowing the meeting. But if I were to go anywhere, I would really love to go to Germany during Oktoberfest.
Well, welcome, Megan.
Thank you.
Nancy King.
good morning, everybody. I'm Nancy King, the Development Director at Southeast Health Group. I'm also a person in mental health recovery and a family member. And I would like to go back to Eastern Europe after COVID is done and spend time in the small towns where my family immigrated from.
Ryan Templeton.
Ryan Templeton, Policy Advisor with the Colorado Department of Human Services Office of Behavioral Health. Slowly transitioning my duties on BPAC over to Renee. Probably this is maybe one of those meetings that truly is that transition time. So thanks, Renee, and everyone else supporting that. Place that I want to travel to is like Norway, Scandinavian countries. My family went there and I missed a big opportunity when my sister was doing her postdoc in Estonia, and they went through and toured that whole area. And I missed it for some reason, or didn't get invited maybe, but somehow get back up there, or get myself up there, and explore that. And yeah, we have family up there or distant relatives, and living that life seems very interesting. So.
Awesome. Well, then let's go ahead and go to Renee.
We're doing the R's now. Ryan, I think someone needs to invite Ryan. I think it was his plea to have someone invite him to go somewhere. I think that would be great. But yes, no, Ryan will still be around. And this isn't just a clear cut, he's leaving us. He'll still be around and he'll participate. So it's good to know. So please don't run away when he runs away from us. Renee Gonzalez, Director of Equity and Community Engagement. I guess one place, there's so many great ideas from everyone that's mentioned, where they would like to be. I think for me, Lloyd, I am my family, we're from originally about 3 hours away from Puerto Vallarta. So my mom is actually back in Mexico right now, and I always talk to her, and she says, man, it's nice and warm here. And I look at my phone this morning and it's -2. And so we'd love to go back to Puerto Vallarta with Lloyd in that area as well.
Awesome. Marjorie Grimsley.
Hi, this is Margie Grimsley with the Colorado Federation of Families for Children's Mental Health. And a beach, any place would be nice, but I haven't been back to visit family in the DC area for a couple years now. So I guess going back and seeing family would be nice.
Awesome. Natalie Brown.
Good morning, everybody. I am the program manager with Summit Stone Health Partners, our community-based recovery support programs, which means our peer specialist team, Spirit Crossing Clubhouse, and supported employment. I am on the membership committee and recovery committee. And let's see, there's so many places that I want to go, but in our trip queue is a family wedding that's been postponed now twice because of the pandemic to Portugal. So hoping that that will come about this July. So we'll be traveling to Portugal.
Awesome. Stephanie Johnson.
Hi, I'm Stephanie Johnson. I am the Director of Community Relations and Public Policy at Mental Health Center of Denver. And current top of my list is to travel to Thailand. I train in and I coach Muay Thai, and I really want to go out there for like a month or two and train at one of the fight camps out there.
Oh, that would be awesome. I didn't know that. Let's go ahead and go with Megan Green.
Hi, everybody. Good morning. Megan Green. I am the Competitive Integrated Employment Manager for the Division of Vocational Rehabilitation and the DVR representative for this group. And my favorite place to vacation is Inverness, Scotland.
All right. James Gannon.
Morning, everybody. James Gannon, a person in active and sustained recovery and the Director of Programs with Advocates.
Oh, you muted. Somehow you got muted on the streams. Doesn't say you're muted, but I lost you. Are you there?
Can you hear me now?
Yes, now we can.
Okay. Sorry, microphone issues. Like I said, I'm James, a person in active and sustained recovery and the Director of Programs with Advocates for Recovery Colorado. And my dream vacation is actually in the planning stages to do a mountaineering snowboarding expedition in the Swiss Alps at the Michabella Peak for next winter.
Beautiful. All right, let's go with Bonnie Holiday.
Good morning, everyone. I am a prevention program manager at the Office of Behavioral Health. And just a disclaimer, I have to head out for about an hour today, present to another group, but then I'll be back. So if you notice I'm gone, I will be back. And where would I go? I think actually, like Ryan, I would go to Norway because I love cross-country skiing. I want to see the Northern Lights. And they have this horse there called the fjord horses. I'm going to try to post a picture in the chat, and they're just amazing. And I've always wanted to see one.
Awesome. Michelle.
Hey, I'm Michelle Kotwas. I am a family member of People in Recovery, and I am also one of the social workers on the addiction medicine consult service at UC Health, serving inpatient. A lot of these vacation ideas I really share. I really want to go to Switzerland, but right now I'm thinking Hawaii would be a really nice place to be.
Thank you. Angie.
Hi, I'm Angie Bold. I am the Director of Operations for Addiction Research and Treatment Services, also known as ARTS, and I'm a member of the Treatment Subcommittee. And honestly, I agree. I think a lot of these sound like great ideas, but I too would prefer anything tropical right now, warm, palm trees, and a beach.
Mm-hmm. Thank you. Glory.
Good morning, everyone. My name is Gloria McDaniel. I am a licensed counselor, bilingual Spanish speaking. Currently the president of the Colorado Association of Addiction Professionals in long-term recovery myself, and the executive director of Cristalida, working with victims of domestic violence.
Thank you. Darren.
Hi, everybody. My name is Darren Valdez. I'm the executive director of Colorado Artists in Recovery. We do our art, music, and meditations for free for all your clients if they're looking for community after they leave treatment. We do a good job of that. I'm a person in long-term recovery for about 8 years. And, you know, I just want to go on vacation. I don't care where it is, really. But I think if I had to pick a place, I think I went to Paris for one day and I didn't get to see all the art galleries. And I think I would just love to just spend 3 days just going through the art galleries.
Awesome. Nancy, I don't think I got you.
Yes, I went.
Okay. All right. Is there anybody else I missed? My screen rearranged on me. Okay. For those that don't know me or that are new, I'm Donda Gorton. I'm with the Office of Behavioral Health, and I'm your go-to on this meeting, I guess is the best way to do it. Anything you need, holler at me. For vacations, I'm kind of like everybody else. I would love to go someplace warm, especially after yesterday or today too. However, yesterday my husband and I decided to start looking at joining some friends of ours on a cruise from Rome to Italy and all that fun stuff. So we're looking into that. So that's my next goal. And let's go ahead and I'm going to turn it back over to Jacob.
Well, thank you, everyone. It's great to kind of learn a little bit more about everyone this morning. Glory, I want to just give a shout out to you. You did a wonderful presentation at the symposium this week. It was amazing. You did an excellent job. But thank you, everyone. Getting to know you a little bit better. Moving on in the agenda, I'll entertain a motion for approval of the minutes.
I'll make a motion to approve.
I'll second it.
All right, all in favor? Raise your hand or thumbs up. Okay, motion to approve minutes passes.
Jacob?
Yes.
Could the record show that I'm abstaining because I wasn't here last meeting?
Yes, we'll add that to the minutes. Thank you, Lori.
Okay, thanks.
All right, next action item. So for those of you who were with us last time we met, we had a presentation from the Behavioral Health Administration. And I think we just kind of want to have a discussion and a debrief around that conversation and presentation. kind of get your all's thoughts on that, especially around where maybe you see this council fitting into that administration moving forward. So this is kind of just a discussion, a breakdown of what that presentation was on your thoughts and feelings. So we kind of know where we're moving forward and getting a consensus of the group. So I'll open that up to group discussion at this point.
Thanks, Jacob. It feels like it's such a long time ago. And so it's hard. Yeah, just to add to Jacob's comment, if you recall, we had Summer come and present on a very general overview or update of the new behavioral health administration. She provided a few slides. So take some time, if you haven't already, just to skim the slides again. One of the big pieces that I remember from Summer is, it was a really important question, is where do we land with this committee in terms of where the larger BHA or the Behavioral Health Administration is going to move forward, and how do we interact, given there's some actual federal stipulations, and Ryan knows a lot more than I do on what those look like because of the funding dollars. So that being said, one of the thoughts, I'm just going to try to remember what Summer said, is, well, there's a Behavioral Health Administration, and then there's going to be a Behavioral Health Administration Advisory Council or committee, and it's going to be community-led. There will not be any state members on the committee. So it's really going to be also facilitated and co-led, from what I hear from Dr. Morgan Medlock, our new Behavioral Health Administrator Commissioner. I think her wish is to co-lead this advisory council. Well, within the advisory council, that's a whole new convening of individuals. Well, where does this group, where's our BPAC group fit within that structure? And I think Summer mentioned, well, it may fit under that advisory council or committee. And I think that's the last thing I remember. But again, any other thoughts to that piece? I'm sure I forgot some other things. Skim the slides, take a few minutes as well.
Yeah, Renee, this is James. Maybe you can give some light on this. So they're going to have their own separate committee. So I guess the question to all of us is, how do we make sure that we have a voice or recommendations and bring that to this other committee? Or can other people that are on this committee be on that committee? I know that's a lot of committees in one sentence, but
Thanks, James. That's a great question and a great idea. Perhaps we can have a dotted line to that committee in some way. But then, yes, as you mentioned, I mean, we can actually have that as a recommendation item. The other piece, James, was when we get to reading the bylaws, that's going to really help us inform, really the teeth that we have with this committee as it relates to the Behavioral Health Administration. So as we go through that exercise, let's keep that in mind. But I hope maybe Donda, will you capture James's ideas around that piece? Because I really like that idea of actually having a liaison from our committee to the new advisory committee somehow in some capacity. Marjorie had her hand up.
I guess my concerns are just what other people have brought up. It seems to me that throughout the process, as the BHA is being developed, it will be critically important to educate them about the purpose of the Behavioral Health Planning and Advisory Council, and them understanding what our differences are, what our different roles are, but then how are we then connected so that we're not stepping on each other's toes, number one. And number two, there isn't that lack of clarity on what lane people are in and when we intersect. Because to me, it would be very harmful for us to put a lot of work into things that on the other flip side, they're doing as well. And or if there's any, we're looking at things from a different lens, and it's really critically important that they hear what our lens is and it's integrated into the work that they do. Because this committee is so grassroots and it is so real people focused, and they'll hear from us in a way that I think they might not hear from other people.
Let's see, we got Natalie and then Nancy.
I agree with James. I think the connection or that bridge between the two groups is important. I would like to add to the suggestion that it be more than just one person acting as a liaison, that there may be multiple members of this group that are part of that advisory group. I really like the collaborative nature of this group, and that we have representation from service providers as well as individuals with lived experience and state employees as well. So I really like that collaborative nature of this group, and I think that's important when we're informing the BHA. So.
Nancy?
Yeah, I had to remind myself like what our role is, and our role is under the Office of Behavioral Health to inform how the block grant dollars are spent. So if you could help me understand what's going to happen to OBH and what's going to happen to the block grant money when the Behavioral Health Administration kind of gets rolling.
I'll take that one. So the community behavioral health part of the Office of Behavioral Health. So everything outside of the mental health institutes, the 2 state hospitals, and forensic services, which is competency, education, restoration, is going underneath the BHA, or essentially turning into the BHA. So everything but the state hospitals and forensic services, as those 2 spots are still staying within the Department of Human Services. So ultimately it's going to feel very similar, I would think, but really this conversation is, how does that concept of this advisory council fit into the goals, duties, and responsibility of this council? I think there was at one time thought about, well, wait, we have Bhpac. It sounds very similar to this advisory council. Are you talking about Bhpac? Which it kind of how it's presented is that the not having the state employees doesn't meet the federal requirements for Bhpac, right? So then it turns into exactly what we're talking about here, is how do we have that collaborative effort? I like the idea of having representation from both and making sure that there are clear partnerships, because the whole point of the BHA's advisory council is making sure that there are clear paths within state statute about how advisory bodies can hold the behavioral health system accountable, right? And I think that's exactly what we've been wanting and pursuing within Bhpac is where is that voice, and what teeth do we have in influencing what the behavioral health system actually does and can be. So with that, I don't want to lose all of the momentum that's been gained throughout the years in Bhpac. But yeah, I mean, with any sort of new things happening, there is all of these questions about where do things fit. And ultimately, it's the same conversation happening in OBH's 2 other boards, the Children and Youth Mental Health Treatment Act board, as well as the 2765, the Mental Health Advisory Board for Service Standards and Regulations. They're in the exact same boat as where do those boards and how do they fit into the BHA? So by no means are we kind of on an island here either with the how do we fit?
But our role is specifically to inform how the block grant dollars are spent. So where are the block grant dollars going to go? Or will they go under the BHA?
Yep. Yeah. It'll still funnel through the BHA, just like it funnels through the Office of Behavioral Health. And really Bhpac is so much more than just block grant recommendations. it's about state planning, the larger behavioral health system. I think we've kind of pigeonholed ourselves a little bit with everything is focused solely on block grant funding, which I think BPAC can be so much more. Talking about how do block grants fill the gaps in what the system contains, and we really haven't had those larger discussions about what is the whole system, what is out there now, and what gaps should block grant actually fill. And I think that's part of the whole accountability structure that the BHA is trying to get to. But ultimately, it's still a requirement from federal law that a group, the Behavioral Health Planning and Advisory Committee, is also submitting recommendations specifically on the block grant. So that duty for this group is not changing at all, nor are the other duties, the larger system duties, the whole state plan for behavioral health duties of BPAC. So with that, I mean, yeah, we still have as BPAC the state law the federal law that state law is not going to be able to change. So ultimately, there is still a massive role for BPAC moving forward.
Thanks, Ryan.
Yeah, I think that, this is going to be an ongoing conversation as Behavioral Health Administration and OBH kind of merge. But what I hear everyone saying is that this committee is uniquely positioned to have not only voices from providers, but also voices from those who are consumers and receiving services and clients. And this committee has teeth, right? It has the voice of those people to kind of shape and mold this administration as it moves forward. We've heard about the gaps in the systems kind of recently, and I just don't want this committee to lose that power that it may have. And so as we're transitioning into kind of going into our structures and bylaws here in the next conversation, I just kind of want that kept in the forefront of everyone sharing how this is a unique council and it has power in it. So kind of keeping us on track, we're a little bit behind. I'm going to turn it now over to our House informative person, Renee, who's done a lot of work, late nights, reading this material and going over it with where our current structures and bylaws stand. So Renee, I'll turn it over to you.
Thanks, Jacob. And I only use the reading material as a way to fall asleep. So what I would do is I would read a paragraph and then I would just doze off and then go back and read it again and doze off again. So highly recommend that piece if those who are can't fall asleep at night. So I'm gonna do an exercise, and what we have plenty of time. I think we allocated till 10. Let me look at my agenda again here. 50 minutes or so for this piece. What I would like to do is I want everyone to take some time. Everybody has access to the bylaws that Donda sent out. I want you to go off camera. I'm going to ask Donda. She's never done this before, and I haven't asked her until like right now. I'm going to ask Donda if she can put some music on, if it's possible. If not, that's okay. But I want folks to go off camera, and I want them to read through the bylaws. It's not a heavy read. It takes about 10 minutes, maybe 15 minutes, but take as much time as you need, go off camera, and I want you to do two things. I want you to write down one thing you learned from the bylaws, reading the bylaws. And then the second piece, and I'll put this in the chat, one thing you learned from reading the bylaws, and one or more, it's up to you, one thing you think we need to work on that's in the bylaws that we haven't done. And so a missing piece, I know there's a few things, I think under the committee bylaw section, there's some things that I think that we can work on as well. But so one thing that you learned from reading the bylaws and one thing that we can work on as a group to adhere to our bylaws. And if there's more than one thing, or if there's an idea, then we can share it out. I'm gonna ask Aaliyah if it's okay to create a document, and we can populate that document with not the first one, not the thing that you learned, but the second question is, what is something that we can work on based on the bylaws? Okay.
And Renee, how much time are you going to give people?
I'm going to give people as much time as they need. What I want folks to do is, if you can do your reaction and give a thumbs up when you're done reading, or go back on screen, then that way it lets us know when you're done reading. But again, one thing that you learned that you'll share out, and then one thing that we can work on or more that we can populate in a document that I'm going to ask Aaliyah to create, if that's okay, and we'll put it in the chat. Laura has a question.
One question. Yeah, sorry, you covered this. I was late this morning. Sorry, guys. There's comments on there too. Do the comments need particular attention or responses or what have you?
No, those are just in comments from back and forth that we need to work on.
Okay.
Thank you. All right, Jacob, where can I find a copy of the bylaws? I think Donda sent it out, but
I will send it again just in case.
yeah, thank you. Okay, one thing you learned from reading the bylaws, and one thing that we can work on as a group. Does that sound okay? All right, based on everybody going off camera.
Yeah, I don't have the bylaws either, guys.
Okay, no, that's good.
I will send it to everybody, but if you can also send me your email if you did not get it, and I will make sure we get it sent out again.
I also just put it in the chat.
Right,
Oh,
thank you.
even
There
better.
we go. That's easier.
That works easier. I won't send it again.
Perfect. All right, and Donna, see if you can put some nice reading music. Look at that. There's some great ideas in the chat. Aaliyah created a document so we can capture those in one location.
We can't access it, Renee.
Okay, that's what I needed
Knows
to know.
how to open documents in Google Docs. I was going to come on here and say I'm not a Google Docs expert. So I'm sure that there's just a quick click to get it to open. Who knows what it is?
When you sent out that link, did you click everyone who has this link has access to this document when you click share?
I actually just shared it from the URL on top of the screen. I didn't share it.
Okay, yeah, you have to go into permissions, and anyone who has this link.
Where's permissions?
So if you click share.
Yeah, so Aaliyah, the top corner, that blue share button will open up another, and then at the bottom it says get link, and then it'll say change.
Did you guys want us to put our comments in the chat?
You can
I know
do
you're
that,
talking
and then I
about
can
creating
copy
a.
and paste it. You can do that, and I can copy and paste it in here.
Okay, thanks.
You want to do that?
Okay. All right. Try again, people. Sorry.
Thanks, Aaliyah. No, thank you, Aaliyah. I kind of put that last minute on her. So thank you for running that piece.
Thanks, Jacob and Ryan and Renee.
How's everybody just doing a check-in? Again, there's no rush to read the bylaws. Give me, do you all want about 5 more minutes? Those who finished can take a quick 5-minute break, or give me some feedback. What do you think? Five, okay. Lori says yes, 5 more minutes, or have a 5-minute break. Does that sound good for everyone? Should we do 5 more minutes of reading some awesome bylaw language? All right, let's do 5 more minutes. Let's see. Thank you, James. How about whoever needs more time, give me a thumbs up. And if you don't need any time, just stay as you are. Okay, I'm just scrolling through the list here. Perfect. Okay, great discussion in the chat. I see people were putting a lot of really good information and content. See, it wasn't too painful, right? It didn't hurt. You know, do a little reading, a little morning reading always doesn't hurt anyone. Learn something new. I know I do every time I read the bylaws. Thank you for those who put the information in the chat. Aaliyah will capture, copy, and paste it in the document. And thank you for those who already put information in the document. So, you know, I've been thinking about the best way to approach this work moving forward. We can do a share out in terms of what we learned as well. But once we think about that piece and what the second part of the question is how we can address some of the things that are mentioned in the bylaws that we need to address as a group. So as you're thinking about this, you know, do we need to take time at our meetings to really, you know, work on specific parts of the agenda based on what people have said? Or do we create a bylaw subcommittee who does the work in between meetings and kind of brings back the information to us as a larger group? So think about that piece, but would love to do a share out. And again, ideas in terms of what you learned or how we can take this work forward. Before we do that, Ryan has his hand raised. Go ahead, Ryan.
I just wanted to clarify one thing. That table in there under membership, that's the only new piece. That's not currently in the bylaws. That was the piece for us as the membership committee. We're starting to talk about, do we need to actually assign specific seats and who represents who? And there was some comments in the chat about equal representation with mental health and SUD. So that was my attempt to put in a table. So that's the only piece that isn't what has been formally adopted as bylaws. So that is the new piece that I just didn't have another place to put it. So that's why it's in there for this. And whether we need that or not, it's for y'all to decide, right? So.
Thanks, Ryan. That's right. That's the empowerment piece that we talked about in that participation spectrum. But yeah, obviously, Ryan, thank you for crafting the language and the content. So Marjorie had her, let's go with Marjorie and then Lori.
I just wanted to mention briefly that in the bylaws, it does mention that the membership committee was going to was part of their role was the working on the bylaws. So I think just since there's so much in these bylaws that I think they almost need to be looked at one line at a time in many cases, but just to clarify that it would be taken out of the membership committees as part of their tasks and put into a separate ad hoc bylaws committee, just to clarify what people's roles are and what they'll be doing.
Thank you, Marjorie. We'll go with Lori and then Lloyd.
Is there a way that we can suspend the bylaws while we do this transitioning? That just popped into my head. But what I really wanted to ask was, does the federal government through the block grants have requirements about like membership, quorum, that sort of thing of the group that is advising, which would be us? So would there be things in the federal government rules that we need to adhere to?
I'm looking at Ryan
I'll put a document in the chat where I copied from federal law about membership of the advisory committee. So there's not going to be a ton of language in there. So that'll be a quick, easy read.
Oh, good.
It's like half a page. So
This is Margie, just to throw out, I guess, because I've been doing this for far too long, but back when it was the Mental Health Planning and Advisory Council, there was a huge amount of emphasis because the 51% of people, that really was what made this unique and something that we fought for a long time. And though I think that the look of the council has changed over that period of time, more than 10 years ago, that 51% has remained. And I would just suggest that 51% makes this group more unique to a lot of others, that really ensures that it has that consumer, family, youth, young adult perspective brought to the table.
Lloyd, we'll go with you and then back to Lori.
All right, there are a lot of good questions just right now that have been brought up, and some that the steering committee and the membership committee have talked about in the past. Such as what are the requirements from SAMHSA on this council? It is a challenge to try to maintain, to get a balance of membership or for council, because we only get so many applications a year. And this last year, thankfully, we were able to receive enough applications that we were able to kind of get under that balance of bringing people on the council. We have previously, for those who have been here for a minute, have updated the bylaws. And it's a process. And as our business needs change, such as having COVID and being on Zoom as our primary, there continues to be just so many things that on a regular basis that need to be modified in the bylaws. So just trying to address and answer several questions in chat. We are, I guess overall, we have met quorum today from our current membership. We are at the 30 plus for membership. I had one more piece on my mind concerning the bylaws and people not having a idea of what's in them. I can say that's part of our orientation, which we haven't done the last few years, but within the last 3 years, the bylaws have gone out at least once to the membership that was present at that point. Like many documents we receive, sometimes we have a tendency not to read them or read them thoroughly. So thank you, Renee, for bringing some of this to the council membership as a whole. That's it.
Thanks, Lloyd. And we're probably going to lean on you based on your background, your experience, and understanding of the process a little bit more. Some of the things I know we have, Jacob, your hand is raised. Another thought is maybe we take a half a day and really, or over 2 half days or whatever that may look like, and really go into the agenda or bylaws and unpack them a little bit further and work on them. But that being said, Jacob, what do you got on your mind, my friend?
Yeah, so the way I see this is there could be a couple different pathways for moving with the bylaws. Is one, there was a suggestion of forming a committee. 2, this can be all the groups work. And 3 is, whichever way we go, having red line copies of this as we work through this so we can see the changes. I think Lori said it best, going by this line by line, so everyone's staying informed and has a voice. But I think there's a couple ways we could go with this, whether that's the group work or whether that's a specific subcommittee. I know another question everyone brought up was what's going on with standing committees and what direction do we want to proceed with. The typical thing we've done in the past is having people in silos, prevention, treatment, recovery, or do we keep that as group work? What are our standing committees going to look like in the future?
Good point, Jacob. And according to the bylaws, all of us have to be in some sort of committee, but at the same time, we can amend those bylaws to what, as Jacob just mentioned, we can tweak that to make it more applicable to what we want to do as well. Ty, you had your hand raised.
Sorry, I'm used to unmuting with just my mic and not on Zoom as well. I just wanted to respond to the standing committees because the Mental Health Planning and Advisory Council is really what got me active and helped me develop as an advocate. I was in the Youth and Young Adult Transitions Committee, and it was one of the most powerful committees in the entire state back in the day. We did fantastic work, and we also had an less active but still very important adult and older adult committee, and that's typically a population that gets ignored or forgotten about. No one focuses in on that. And when we transitioned into the Behavioral Health Planning and Advisory Council, we made those three committees: the recovery, the I can't even remember them all, and we lost so much influence and power and people because there are people who specialize in certain areas, and there's no way a recovery committee can focus on the needs of adult and older adult, as well as I think we did have a rural and frontier committee too, Nancy, but you know, we didn't. It's just so important to have you know, kind of those areas where people can focus in and use their expertise and really contribute, rather than feeling part of a committee that's too big and too amorphous to accomplish anything for their area's work. So it was just, I just want to say how important it was to me, and I actually resigned from this council because of that, because I was a youth person at the time, and I didn't feel like my voice was being heard. And right now, with the emphasis on diversity and trying to get different people to the table, you know, it's too hard to bring everyone to the council. It's too hard to bring everyone to the table. But if we can have very highly focused committees, we can have those committees really create great positive impact and change in the state. So, you know, I really wanted to say that.
Thank you, Ty. Thank you for sharing and your reasons to the why of joining these types of committees. Lori, you had your hand raised.
Hi. One of the challenges we have talked about with trying to get some balance on the committee is if we have X number of people, as a question was brought up in the chat, rural and frontier communities, and we put people in those slots. If we say 5 people or 3 people are from that, then those people become token representatives. And with some of the other demographics we have on council, that can be a slippery slope because that person may not want to represent that demographic. So it's one of those things that we need to struggle with. what I wanted to mention before. There's pieces that, for example, membership that are or should be in the bylaws, but there's also other pieces, particularly with membership, that is more of a process of what we go through versus bylaws. And that's something the membership committee has already addressed that we need to do, as there isn't a current document that kind of spells that out. That's it.
Thanks, Lloyd. So I think I have about 10 minutes left on this agenda topic. Now thinking about the best way to approach this bylaw work, because there's so much to unpack. And what we can do is we can take a vote, not now, perhaps we can take a vote, send it to everyone about the best way to work on the bylaws, whether it be a subcommittee, whether it be as an entire group. We would have to work in between meetings and so forth. Or do we take a mini retreat and work on the bylaws? And we would provide food and so forth. And I have to find out. I don't think we can meet in person until the end of this month, until we receive more direction. But that's another option as well. The committee's piece is a very big part of this bylaw that we have to work on. So does that sound okay to folks in terms of getting a survey out to you all and see how to best address the bylaws and work on those? Also welcome to other thoughts and best ways to do this, better ways.
Renee, I think that's a great idea, is maybe we send out a poll and we can present motions in the formal agenda in the next meeting, and have a couple of motions and see which passes, and then kind of have a clear direction of where this committee would like to move forward with. Council, sorry.
Thanks, Jacob. Lloyd, you had your hand raised?
That was from previously. Somebody didn't take my hand off after my conversation.
All right, fair enough. Okay. Any other thoughts? Aaliyah, were you able to capture the notes from the chat? The comments? Okay. Let's see. All right, well, good. I hope we all learned something from our bylaws today, and we can move forward to unpack them a bit further. I think it's an opportunistic time in the sense that we should also start including, and I saw Leah's hand raised, so let me finish my comment and I'll popcorn it to you. I think this is a really great time to start adding language in the bylaws around how we fit in to the new Behavioral Health Administration, to the new Behavioral Health Administration Advisory Council. If we can get those in our bylaws, and that would even make more of a stronger connection to the work. Aaliyah, did you have a question, comment?
Yeah, I just wanted to mention that I am going to clean this up, and if it's okay for us to send it with the minutes, everybody can kind of see what everybody was saying. I have the notes and from the chat, so I'll be able to make sure that everything was captured. So I just wanted to let you know that it's not going to be the end of this meeting where it's done. So
okay, thank you, Leah. Yeah. No, it's when everybody jumps onto one document, everybody just tweaks the format a little bit. So thank you for cleaning it up, and we'll give you enough time. We won't send the meeting minutes immediately. We'll give you enough time to work on the document as well. Are there any other last comments, thoughts, concerns, questions with our next steps in terms of working on the bylaws before I pass it back to Jacob? All right, seeing and hearing none, I think, Jacob, floor is yours.
Thanks, Renee. Thank you for all your work. That was a wonderful exercise. I love the music. It's great to jam out in this meeting. And thank you everyone for your input into this. This is really going to determine the direction that BPAC is moving in the future, and especially with equity and inclusivity and diversity, we want to make sure we're going in the right direction. So this next section is what's going on. So this is the opportunity for you in your different spectrum on the continuum of care to kind of talk about what's going in that world, going on in that world. And we'll start with prevention. Prevention is your jam. Share with the group what's going on in that world. I know Bonnie had to step out. But if there's any information, exciting news, questions, things that you'd like to talk about with prevention, the floor is yours.
I just have a question in the prevention realm. Have we ever had Lisa Rayville from the Harm Reduction Action Center come to speak with us? Because I know she has a couple, she really is working towards like a safer use space or a safe injection space. And I know that's, you know, it's very political, but she could use a lot of support politically. And I don't know if that was something that might be useful to the council. So just wanted to put that out there.
Thanks, Michelle. That's awesome. If you could put her maybe contact information in the notes or in the chat, we can see if we can add her to a future agenda to present and kind of fill this time on letting us know what's going on. Awesome.
This is Margie Grimsley, and just in the world of prevention, again, I don't know if people would be interested to outreach to the work being done by the Jeffco Communities, the CARE group. They are the prevention arm for the state collaborative management program. So it just might be another thought to have someone come and bring in a different way work that's being done, but really amazing work. But it would also show the work being done by the youth interns in that program.
Good idea, Margie. I added that to as a possible reach out and presentation. All right, moving on to treatment. Any news or information or kind of stuff that's exciting that's going on in treatment?
I have one. Southeast Health Group has started an ag advisory committee a few years ago, but we just dedicated a space in our Rocky Ford facility for the Coffee Break Project. And we have a new website, coffeebreak.org, I think, coffeebreakproject.org. And it's specifically outreach to farmers and ranchers to teach them about how to talk to their neighbors about behavioral health concerns. And we do some suicide prevention training and some really basic mental health first aid and stuff like that to help people understand how to do outreach among the ag community and the ag worker community. So I think it's exciting that it's happening from a grassroots level and that we actually have a space now for it.
So Miss Nancy, is it all right if I talk, Jacob? I don't know.
Oh yeah, this is an open forum.
Okay. Is there an opportunity for somebody to come down to Southeast Colorado and talk? Like, do you guys have speaker bureau or happy birthday on Friday and somebody could come down and talk? Or are you looking for people to just drop in? Or are you just talking about it for us to, for our knowledge?
The Coffee Break Project is a dedicated space with coffee and donuts, and anyone in the world can stop in there and visit with the staff and learn about the programs. But I'll put the website in the chat. Oh, Donda already did. So that you can get a sense of what we do there. But it's really about prevention and getting people connected to services, and it's really rural. I mean, we speak rural. It's all very much the tagline, or our main tagline is, do you look after your neighbors as close as your crop or your herd? So it's really about, we try to speak the language of rural Colorado.
Yeah, that sounds awesome, Nancy. I think that's one of the areas that we're always looking to explore and see what's going on is rural and frontier, and the state is larger than the metro area. So however we can grow that help in those other regions is awesome. All right. What about recovery? What's going on in the recovery world?
This may be specific to community mental health centers, but it may expand beyond that. So I thought I'd better put it out. The accredited clubhouses, Spirit Crossing Clubhouse and Frontier House, are putting together a forum to present a proposal to HCPF for those programs that are using the billing codes within Medicaid for clubhouse and drop-in services, to update the coding manual description, as well as the description of clubhouse programs and drop-in programs. So if any of you use that billing code, it is H2030 or H2031, and would like to join us, let me know. We're having our first forum next Friday to get some input from other programs that are using that billing code, so we can present to the HCPF coding committee the following week. So a little bit of work to do that, just to update the code and hopefully reduce some of the documentation burden that our programs have related to using that billing code. So let me know if anybody is interested in joining. I'll send you the meeting link.
Awesome. Thanks, Natalie. Ty, I see you have your hand raised. Ty?
Sorry, it takes me a minute to unmute on Zoom. I'm used to my headset doing that. I have two things. Colorado Silk, which is a statewide independent living council, is meeting this month. If anyone's interested in the independent living community, I can get a link out to Donna and people can join. We have it's for all disabilities, and it's a great community and a great way to know what's happening in the state. I also want to say that the Colorado is going to host a national conference this year at APSB, which is about employment first and helping people find work. I can get that information out to Donna and as well, and send it out to the community. I just thought the community would like to know about both those things. Thank you.
Awesome. Thanks, Ty. James.
Yeah, thanks, Jacob. Just want to throw out there that hopefully by the end of this month, we will have offices in Arapahoe County and Jeffco County, along with our Denver office. We also have an office in Sterling, Colorado, and we also have one that serves Montrose in Delta County. So, for anybody that has clients or participants living in those areas, we provide free, and I do mean free, we don't charge anything for our recovery support services. And we just onboarded 5 new coaches. And actually one of them is our very first family support specialist. She's an amazing lady that lost her son to an overdose. So she's coming on to do that peer work with our families, loved ones, and friends of people with substance use issues. So if anybody has anybody that is looking for those services, please feel free to reach out to me. And just one fun announcement. We are bringing back our annual Super Bowl party that will be at our main office at 6981 Federal Boulevard on February 13th. Really was hoping my San Francisco 49ers would be in it, but that's not going to happen. But we're still going to have a Super Bowl party. Doors open at 3:30 and kickoff is at 4:30. I guess maybe one thing I could do, Donda, is I could send you the flyers and then we could disperse them out. Cool.
Awesome, James. Woo, party.
So I don't have a lot, anything really different about than last month. They're doing the scoring for the PATH. So we will have the PATH grant, which is not block grant, but an important service that we provide at OBH pretty soon. And we are doing a massive expansion of IPS, individual placement and support, which is the supported employment evidence-based that we use to get people struggling or have struggled with mental illness to get jobs. So that's kind of it. I'm just okay. Yeah, I'm done. Okay, thanks.
Thanks, Aaliyah. I know IPS was a huge recommendation in the last block grant cycle. So excited to hear that that's coming to fruition. Trying to think if I have anything. Yeah. All right. Membership. I'm going to add membership into this.
Good morning again. Yes, I asked Jacob to add membership. And I guess first of all, membership has continued to be in that ad hoc mode as we have struggled to maintain our 30 person membership count, let alone that 51%. So that has been the focus of membership for quite a while. I would like to ask everyone, and this is maybe something Donna, we can get out via email since we have a limited number of people currently online with this, is our recruitment process over the years, I will call peer recruitment, because we have sent out to the council as a whole, the membership application, asking them to spread the word. And normally that has worked to a degree, but one of the questions that the membership committee has struggled with is how do we get our recruitment processes beyond the council? Or in that process specifically is getting people to apply for membership to the council. So not something to be answered right now, but membership is looking for ideas of how else we can distribute our need for members for the council. I guess that's the key focus of membership right now, is a continuing ad hoc process to try to maintain our numbers, because all it takes really is 1 or 2 resignations to throw us off balance right now. We need to get beyond that. That's it.
Thanks, Floyd. James, you still have your hand up, or you have something new? Okay. Yeah, I think, you know, this council, I was invited on by someone from this committee. So if there's individuals who you think would be a good fit, please, you know, get with Lloyd. And this has really been how we've recruited in the past, is through peer and contact to contact. And, you know, Lloyd reached out to me about 5 years ago. So just think about who we can connect to this council as we continue to go through this. I'd just like to continue to say, you know, this is really your time on the committee to do shameless plugs, to let us know what's going on, to promote your organization, to come up with ideas for presentations. So please continue to do that. I love this portion of the meeting. But with that, I think we're a little bit ahead of schedule, which is not a bad thing. But let's take a 10 to 12 minute break, or 10-minute break, and come back at 10:50. And we'll turn it over to Ryan for the OBH updates, and Ty, and I'm sorry I'm blanking, but other subcommittee updates that our members are a part of. But yeah, let's meet back up here at 10:50. All right. See if people are coming back online. Couple people back. All right, welcome back, everyone. I'm about to turn it over to Ryan, which I'm sure has a lot of updates because the legislative session has started. I'm sure there's a lot of activity going on, but Ryan, I will turn it over to you.
Thanks, Jacob. First off, Ty, do you want to provide any updates on the mental health disorders in the criminal and juvenile justice system task force? If you're back.
I never left. It takes me a second to unmute. I don't have much of an update. We spent most of our time going over the piece of legislation that kind of puts our committee into existence and renews it. We have decided we were deciding whether we want term limits, and there was a vote to address some of the concerns that we had within the piece of legislation that will renew our council. Other than that, there were committee reports. The data committee is still interested in doing a high-end utilizer report, and I've reached out to Ryan and Renee about trying to get someone from the Office of Behavioral Health to come in and look at trying to get us the data we need from the office, as well as other entities. The other committees, we missed a few people, so the committee report was pretty fast. But that's where a lot of the work is being done, and push forward. So if there's specific things that you're interested in, there's a housing committee, a data committee, a youth committee, and I think one more committee that I'm blanking on. I'd be happy to connect you. You don't have to be a member of the task force to be a part of the committees.
Yep, and Ty, just to follow up on the request to have staff at the data committee, I forwarded that to our data and evaluation director, as well as our some other staff to gauge interest and let them know that the request is to have staff there. on the 17th. So I'll let you know once I hear back specifically about a person, and I'll reach out to you as well as find the meeting information.
Okay, thank you.
Yep. Any questions related to the MHDCJS task force from folks? We'll go over the bill shortly that I was talking about. And then Lorraine with the State Rehabilitation Council. Any updates there?
Yes, and actually got Megan Gallegos here from the SRC also. But I'll just say that last, on the 19th of January, there was a retreat, the SRC held a retreat, and so each of the committees met. The Employment First is the committee that I'm on for this group, and so we walked through a lot of the goals and objectives for the year, and then the Employment First group is meeting again tomorrow from 9 to 10:30. So as you know from previous meetings, there were, it was change in leadership at SRC. Megan is really great and led the retreat very well. So I think we have a lot to look forward to, but I don't really have anything else to report right now. I don't know if Megan would like to add anything.
Nope, I think you got it.
Yeah, so more to come next month.
Yep. Thank you, Lorraine. Thank you, Ty, for representing Bhpac on both of those. And Renee.
Oh, really quick, sorry. Lori just mentioned in the chat, she's having a difficult time understanding and hearing. I just want to make sure. Lori, are you able to hear us on your side?
Yeah, I could hear everyone. I just was having a difficult time hearing and understanding what Lorraine was saying. So I don't know that I got all that report out, but that's fine. I'll read the minutes.
Okay, thank you, Lori. Sorry about that.
I'll send you a direct chat, Lori. How about that?
Yeah, so any other kind of rumblings, gossip about boards, commissions, other task force going on related to behavioral health? I mean, this is kind of our opportunity there to kind of address what else is going on in the world of behavioral health through boards and commissions. So hear anything, kind of open that up here before we trudge along. Bonnie has some gossip for us.
Yeah, I have some good gossip. So we actually, I think she started this week, but we call her our prevention collaboration. I can't remember the last part of her title. I'm going to call her our prevention collaboration position. And so her name is Tammy, and it's going to be her role to really solidify the collaborations between different state agencies that are working in preventions, and also university partnerships and stakeholders. So, in the past, this had been one of those things that was kind of an other duty as assigned, and sometimes it was neglected, but I'm really excited to see what this, increased capacity can bring to prevention. And I also, so might be being a bit of a diva here, but I had to present in another group and I'm back. So I'm not sure if this is the best time to share this, but we have a new course called Prevention 101. And it's a self-paced 1 to 2 hour long course. And it's basically just an overview of what we do in upstream or primary prevention. And just wanted to put the plug out there. It's free through Rocky Mountain Public Health Training Center, and people are really liking it. One of my grantees who feels comfortable enough with me to tell me most of the courses that I ask her to take around budget monitoring, she never has a good time, but she said this one was fantastic and was upset that I didn't have her take it a long time ago. So wanted to put the plug out there for that. And yeah, sorry if I'm being a diva and, pushing my own shameless prevention agenda here.
We're all about shameless here, Bonnie. It's all good. I forgot to mention this in what's going on, but Colorado Providers Association is having a stakeholder meeting for the Peer and Family Support Specialist Committee on Wednesday, next Wednesday. So I will leave my email in the chat if you'd like to be invited to that and just kind of see where the board direction is going. We want to make sure that we're just being inclusive, expanding on diversity, kind of the same things we've been talking about here, but where the certification committee is going forward in the state of Colorado. So I'll put that in the chat.
Yep, and continuing on with that, folks, sign up for the OBH news and updates. I'll put the link there. There's a lot of good information that comes out once a month. And there it also allows you to kind of get on stakeholder call lists and whatnot if you're interested in that. So here's that. I feel like we do this every month, but if there's that. But then we usually provide some regulatory updates. There is no rules from OBH pending right now with the kind of the wait and see aspect of the Behavioral Health Administration and the massive regulatory overhaul that will take place once that bill, if that bill were to pass. But with that, as we promised last month when we did the Civics 101 presentation, is that the session will have started by this February BPAC meeting. And so here's the bill dossier that put in the chat here to make sure everyone can open up, and then I'll share my screen if and then we can kind of walk through what this does. And also at the end of going through these 16 bills, we can have the conversation about what else do you need within this dossier about what would be meaningful to have, because I can have this updated continuously. So first off, can everyone open that link that I just put in there? Perfect. So I'm going to share my screen to just walk through it if that sometimes easier for folks, and I can just point out different things here. So hopefully my screen is the same as the screen that you opened up. Yeah, so a lot of information on here. So a key up here that I threw in here is that you can learn a lot more about each one of these bills by going to this website. This is the General Assembly's website, and putting in specific bill like this. So Senate Bill 21, and then put the number in on that website, goes directly to the page that will contain the fiscal note and all of the stuff that this website where I pull to get this dossier from. Yeah, it contains all that information. But ultimately what we have here is links. You should be able to click on each one of these links to get to the actual bill language, right? So when we talked last month about breakdown of a bill, here's your bills, right? Introduced the number, House Bill 22-1052, who's the sponsors, the summary, and then the actual language. The all caps, new language. Strike through is language that they're looking to repeal. So that's that. Any kind of initial questions about, wait, this is way too much information, super hard to understand, just stop me, raise your hand, say, slow the heck down, Ryan. But then we'll generally go over kind of each one of these things. First one up, promoting crisis service to students. This was up in committee earlier this week. My days run together. So it passed initial committee. This is putting the crisis, Colorado Crisis Services contact information on the back of student IDs. Yeah, there was a lot of really great testimony from a lot of youth. So even thinking about expanding membership on BPAC, there's even a potential to pursue some of those folks that are very engaged in the legislative process. They're coming from the Colorado Youth Advisory Council. So COYAC was the leading champion for this bill, which is fantastic. Yeah, so that one's moving its way through. It passes first committee and goes to the, it's going to sit for a little while, I'd imagine, in appropriations. It goes through the first committee, and if there's a fiscal note attached to it, it goes to the appropriations committee where they actually talk about the budget or the fiscal impact of that bill. So that's where it's just hanging out now. Yeah, so there was some talk about amendments to this bill that they didn't formally get passed in that committee, specifically about this bill currently has only public schools and their IDs get the crisis information on the back of those IDs. There's talk about expanding that to all schools, including private schools and charter schools and whatever other schools aren't public schools. So just be on the lookout for that if you're interested in this bill, is that there are some amendments working their way through more of the back channels and will be on the floor, is what it sounded like during that committee. Questions about that bill? Not seeing any. Next one, House Bill 22-1061. That's modifications to not guilty by reason of insanity. This is the one we've talked about over those last few months coming out of the Legislative Oversight Committee concerning the treatment of persons with mental health disorders in the criminal and juvenile justice system. So this is the Oversight Committee that Ty represents Bhpac on the task force that informs this Oversight Committee. So that's one of the bills coming out of that. This is making changes to this initial one is making changes to when someone is found not guilty by reason of insanity, that they have a maximum term to serve as an inpatient patient at the state hospital. That would be a percentage of what their maximum term if they were convicted of their original charge that they were found not guilty by reason of insanity for. So a lot of timing, a lot of information related to what types of original charges. So if you're interested in that stuff, there's a pretty massive fiscal note attached to that one. I think originally it was like $30 million worth of additional funding for the state. So that one goes to the Judicial Committee on Wednesday, February 9th. So next week. Jail Standards Commission. This is setting up a commission to try to standardize what services jails need to provide, county jails specifically. Right now, county jails run their own jails, so there's not a whole ton of standardization across different jails. So this is trying to come up with some sort of commission to really standardize what jail services look like. There are some behavioral health components in there, nothing related to OBH specifically besides having a seat on that commission. But it's also an interesting one to essentially kind of secure that, wait, there needs to be some sort of behavioral health care happening in the jail setting, which is an interesting piece. So another one coming out of that MHD-CJS Oversight Committee is this Emergency Mental Health Treatment and Evaluation Standards. This is that one that we also previously talked about where it changes the criteria for placing someone on a 72-hour mental health hold. Also, I mean, if maybe this isn't the first one you look at to try to get an understanding about how bills work, because this is incredibly confusing, just based on I think it's only like 2 pages long, but they're trying to add definitions that reference other defined terms. So it's just kind of a confusing mess of what the criteria actually will be. Specifically talking about what's the difference between imminent, substantial, and significant risk, where substantial risk is defined as something more than, well, let's actually just look. Right, so this is what I'm talking about. So substantial risk means a risk that is greater than a significant risk without significant risk being defined. So kind of one of these bills that is a little bit confusing about how the state is supposed to interpret that and actually get the services that individuals need.
I'm sorry, I have a question. Can you share who is supporting that bill and who initiated it?
So it's coming out of that Legislative Oversight Committee.
Okay.
Yeah, and so then the actual sponsors on there are Benavides and Amabile. There isn't House or Senate sponsors on there yet. There's 2 prescription drug monitoring program bills. I just saw these when I was going through bills yesterday. I haven't reviewed either one of these. So if you're interested in what the prescription drug monitoring program is and what changes these bills are making to it, to me, it looked like it's two of the same bills just coming out of the different chambers. There's a House bill, so House Bill 1115, and see if I can just find this Senate Bill one quick. Yeah, prescription drug monitoring programs, so Senate Bill 27. To me, they look very similar. I don't know what the differences are, but they're both making some updates to the prescription drug monitoring program. Next one's an interesting one, plant-based medicines. So House Bill 1116. So this is creating a medical review panel to review and study the use of plant-based medicines, which is defined as a naturally occurring hallucinogenic plant-based compound. So think like psychedelic mushrooms and in treating mental health. So kind of some original or initial concerns with this is that using plant-based medicines like this are not FDA approved. So it seems kind of hard to have an actual study and using for this, but it's also an interesting that they're not saying that it's can be used for this. It's just studying it, but yeah, and another interesting one that came up pretty quick within the session. I threw supporting local media in here just because there's an impact on all of OBH's campaigns and how we get information out to communities. So this bill is requiring that each state department spend at least 50% of their money on advertising that goes directly through local newspapers. Our response to this is that we currently our budget on advertising, it's less than 1% goes through local newspapers. So there is potentially concern that we won't be able to reach the populations that we actually want to target if this were to pass, because 50% of our funding would have to go through local newspapers. Getting into Senate bills now, Senate Bill 5, Law Enforcement Agency Peace Officer Services. This is creating new grant programs within Department of Local Affairs to support law enforcement and trauma-informed services for law enforcement related to the traumatic events that happen with law enforcement officers. So it's expanding that. There's obviously a behavioral health component related to that, not specifically OBH related, but wanted to make sure that this group is aware that we will also put on within this dossier bills that have impact on other state departments, but are behavioral health focused as well. Same with this one, Senate Bill 10, pretrial diversion for persons with behavioral health. This is adding individuals with behavioral health concerns to the list of individuals that can be referred to pretrial diversion programs that are run out of district attorney's offices. Yeah, so it's kind of allows individuals to do those pretrial programs instead of facing those charges and stuff like that. I also threw in a boards and commissions bill here. This is a pretty massive one that changes a bunch of the state specific boards that are in state statute. Just kind of realigns them, update some of those things. Just a reminder that Bhpac is not in state law, it is in federal law. So this bill doesn't specifically impact Bhpac, but if you're interested in all of the other boards, this might be a bill for you to look at as well. So treatment, behavioral health disorders, justice system. This is what Ty was talking about, that bill that continues the legislative oversight committee where this bill is coming out of, as well as the task force that Ty represents Bhpac on, including broadening the name from mental health disorders to persons with behavioral health disorders, adjusting task force membership. And to be clear on this, is that this bill coming out of this oversight committee would actually, CDHS or the Department of Human Services have 5 seats on the task force. This as originally drafted, bumps that down to 3 seats, but also removes the seat representing the Behavioral Health Planning and Advisory Council on it. Yeah, I mean, I think this is an opportunity to take a close look at that, as well as we talk through what our bylaws say and how we coordinate and collaborate with other task force commissions, boards, because if the BPAC representation does formally get removed from this, I mean, I think there's an opportunity for us through bylaws to make sure that we are still having a close collaborative partnership with the task force working on very similar stuff. Thoughts on that one?
We didn't talk about that. We had a lot to talk about during that meeting. I didn't even realize that my seat was one of the ones at risk. It would be a huge loss to that committee to lose another peer on that voice. There isn't many peers compared to professionalism, people in professional roles. So that's something that they should be aware of, I think.
Hi, this is Margie. Or is there any way to understand why that decision? Do you think it's lack of understanding the importance of having those positions there, or is it just, was it purposeful or by accident?
I think it was by accident because other positions were left out that were very important. I don't know why from what we originally talked about, they were trying just to copy paste. Well, my understanding was they were trying to replicate what they did in previous years without changing it significantly. You know, we had a huge talk and there was a huge debate about term limits on the council and how that would really disrupt the council itself. And so a lot of time and energy was really focused on that. And then a few people really started to dig down into the seats that we've had and the seats, the number of seats that we had, and we noticed there was a discrepancy. So we didn't really focus in on what seats were being removed as much as we should have, in my opinion.
Yep, so these are the seats that are in this bill now. So it's a strike and replace, so it just struck the old language to put a new language, so it doesn't show like representative from the Behavioral Health Planning and Advisory Council actually being taken out of the bill, but with the replace and not having it in here, that's essentially what it does, right? It's the same thing that the mental health institutes have a seat specifically on here that also didn't make it into this version. Yeah, so that's also one that I'm not quite sure what the background of the reasons why. It's coming out of legislative committee, so I'm guessing there's just a bunch of different moving parts within that. So be on the lookout for that one as well, and I'll make sure that any amendments that we do see with this, that those get included in our discussions every month. Any other questions related to that one? Senate Bill 21. Kind of talked about this prescription drug monitoring, very similar to that House bill. I haven't really reviewed it in depth. I put this one in here, Senate Bill 55, alcohol monitoring for impaired driving offenders. Just as a one, because the Office of Behavioral Health approves those DUI programs. It doesn't specifically have any language related to that, but obviously there's some impact related to DUI convictions that play a role into who needs to go through an approved DUI program to meet their court and DMV requirements once if an individual does get charged with the DUI. Senate Bill 77 creates a compact for licensed professional counselors. So LPCs can practice across state lines and not have a license in that state as long as it's a compact state. We've seen this bill for similar professions over these last couple of years with, I think there was a social worker one, there's a nurse one, there's a psychologist one, I think there was a physician one over the last few years. So this one's LPCs are next. Another one that was informed about yesterday was Senate Bill 104, the tribal governments included in state programs. So this one, I have a meeting with our tribal liaison tomorrow to talk specifically about what this bill does and the impact it has. But it's my understanding is that it really promotes tribal governments in the ability for them to be considered state programs to ensure that there are tribal representation in state programs and whatnot. But we're doing a little bit deeper dive into that, and I'll have more information at the next Bhpac. And then the last one on the list that I pulled from yesterday was conflicts of interest in public behavioral health. This is a bill that requires our managed service organizations, so those entities that are responsible for the payment of substance use disorder services across the state, as well as our ASOs, administrative service organizations that are responsible for the crisis system, as well as the regional accountable entities and those Medicaid RAIs, to have certain board representation to ensure less conflict of interest within their networks, within their board makeup. Kind of an interesting bill, essentially is making requirements for boards within oftentimes public or private entities. So an interesting one to keep an eye on because there definitely is some impact if you're an ASO, MSO, or a RAI. As well as how those services are provided out of those entities. So those are the 16 bills that I went through yesterday that were related to behavioral health. If there's any other ones, let me know and I can make sure that gets added onto our dossier, but it kind of continuously gets updated. So the link you have should be updated continuously. So it's not I have to wait until next time. If you keep that link, it should get updated once new bills get put in here. So with that, any questions about bills before we talk about what other information do you want in this dossier? Questions?
Brian, this is Margie Grimsley. I was just thinking as you're going through these pieces of legislation, do these pieces of legislation align, and I'm sorry, I put my printer on, do they align with what we have identified as the issues that, workforce, our subcommittee work and those type of things? Is legislation reflecting what we've been working on or vice versa? Are we working on what we're seeing reflected in legislation?
So I would say not these specifically. These are not any of the bills that CDHS is driving. So obviously you didn't see the Behavioral Health Administration bill in here because it hasn't been introduced or fully drafted yet. You haven't seen the CDHS crisis bill in here because that also hasn't been introduced or completely drafted yet either. So I think, and this list doesn't contain any of the bills coming out of that Behavioral Health Transformational Task Force either, because those also have not been introduced or drafted yet. So I think, Margie, you'll probably start seeing some of those in the near future, but they just haven't launched yet. So these are more of those behavioral health related bills that, anyone can, through their local legislators, can kind of push for ideas, or local legislators having their own ideas about what is needed. And these are just ones that have that intersection with behavioral health, but doesn't necessarily, or they may or may not align with the larger scope of what we have been discussing within BPAC about what is needed.
Thanks.
Yep. So with that, is the right information on here? Looking at this, there's one other piece that I can potentially put a link to the fiscal note once, but I'll take a look and see if I can get the fiscal note linked in here as well, so you can see what the fiscal impact to each one of these bills are. That'll be the formal fiscal note coming out of Legislative Council. So to see the cost of each one of these bills.
Ryan, question, once these bills are drafted, are there still stakeholder opportunities, or is this kind of set to go to committees and then vote?
There are occasionally stakeholder meetings even after bills are drafted and introduced. A lot of times once that happens, there really isn't any opportunity, or there really is no opportunity for like, oh, we need to change these words right here because then it goes in through committees and formal amendments. There might be stakeholder meetings just to generally talk about this is the intent of this bill, but not the here, what do you think? What do we need to get added? Because that's through the amendment process once we're here.
Okay, thank you.
Lorraine, I see your initiatives related to impact on the Marshall Fire. I haven't seen any specifically, but I can take a look as well. Have you heard of anyone, or has anyone else heard of? My focus was more on the behavioral health, and I didn't see any specific tying behavioral health to the Marshall Fire, which I'm sure there is some behavioral health related components to that, right? So
Well, maybe it's too soon.
yeah, so with that, let me look at the calendar here. So we're on day 23 of 120. So yeah, less than 100 days left of the session. So yeah, so like I said, I'll see if I can link fiscal notes into this dossier. Like I said, this link should continue to stay the same and active with any sort of updates to it. If you're one of those folks that just keep things open in your on your computer, you might need to refresh it. But other than that, this should be the same link. But we'll test that out next month. So with that, that's kind of all I had is other OBH staff, any other updates you want to address here, any legislative components? I don't see Katya for youth committee specific updates. So I guess with that, I'll kick it back to you, James, or Renee, if you have anything else to add.
No, thank you, Ryan, for going over the legislation.
Yeah, thank you, Ryan. Thank you for keeping us updated through the session. I know there will probably be numerous changes and updates as we go along, and I appreciate you keeping us as informed as possible. That is all we have for this agenda. Does anyone else have anything to add? And Ryan, just quickly, is Katya scheduled to come? Do we need to keep going until if she's going to come, or?
No, sorry, I'll jump in. She was on vacation and she wasn't sure when she was going to be back. I'm sorry, it's not even vacation. Her dad passed away. I'm sorry. So she was out of the country, and And so she wasn't sure when she was going to be back and how that schedule. So she's not planning to be here if she wasn't here already.
Okay. Thank you all. So with that, our next meeting will be March 3rd at 9 a.m. And I would entertain a motion to close.
I second that.
All right, motion's been held. All in favor?
Aye.
This is Ty. Aye.
Okay. All right. Well, we look forward to seeing everyone March 3rd. Thank you again for all your input and help with the structures and bylaws today. We'll keep you updated as the Behavioral Health Administration information continues to come forward. And I'll look forward to seeing everyone on March 3rd. Thanks.
Thanks, Jacob, for facilitating the meeting. Always a great